Imagine wiring a brand new high-tech smart gadget into an older home. You plug it in, and you're expecting this totally seamless upgrade.
Right, but instead the circuit breaker violently trips.
Exactly. The breaker trips, and the walls actually start smoking. And the thing is, the gadget itself isn't broken.
No, it's the hidden infrastructure. It's the forgotten wiring buried behind the drywall that causes the catastrophic failure.
That is the perfect way to visualize what is currently happening in the world of women's health and wellness. We tend to view these modern medical upgrades in total isolation.
Oh, absolutely. Like treating the human body as if it is a completely blank slate.
Right. Okay, let's unpack this because the stakes here are incredibly high. For this deep dive, we are pulling from a stack of FDA warnings, the UK's NICE clinical guidelines, and specific medical device safety labels.
To look at a highly critical intersection in women's health.
Yeah, we are focusing specifically on energy-based devices. So think cosmetic lasers and radiofrequency machines, and the strict contraindications for using them if a patient already has a pelvic mesh implant or a copper IUD.
It's such a vital conversation to have with you all today.
It really is. We are going to figure out exactly why combining these seemingly unrelated treatments can trigger hidden medical emergencies.
Because you might be considering a non-invasive cosmetic procedure at a med spa, right? Something marketed as a quick lunchtime fix.
Like you're in and out in an hour.
Exactly. But if you have a medical device permanently or even temporarily implanted in your pelvis, introducing new thermal or electromagnetic energy changes everything. The clinical data shows this is not just unpredictable, it can be severely damaging.
Wow. Okay, so before we get into the crash between the new gadgets and the old wiring, we have to understand the gadgets themselves. The clinical term in our sources is energy-based devices, or EBDs.
Right, EBDs.
And these are heavily marketed right now in gynecology and dermatology. But what are they actually doing to human tissue?
Well, we are primarily looking at three specific technologies here. First, you have fractional CO2 lasers.
Okay.
And the term fractional just means the laser beam is broken up into microscopic columns. So instead of burning an entire sheet of tissue, it pokes hundreds of microscopic thermal holes.
Oh, so it leaves healthy tissue in between to speed up the
I
healing.
got it. It's much safer than just, burning the whole area.
It's kind of like aerating a lawn to get the grass to grow back stronger.
That is a great visual, actually. Yeah. Then the second type is the erbium YAG laser, which uses a completely different wavelength of light.
Okay, how is that different?
It doesn't penetrate as deeply as CO2 because it is absorbed much faster by the water sitting on the very surface of the cells.
Oh, gotcha. Very surface level.
Right. And then the third type is radiofrequency, or RF machines. Now, these don't use light at all. They use electrical currents to generate heat deeper within the tissues.
Deeper down. Okay, so looking at the history in our sources, the original FDA clearance for these devices was entirely clinical. They were designed as surgical tools to obliterate diseased tissue, right?
Yes, exactly. Things like treating genital warts or destroying precancerous cervical cells, they were effectively high-tech scalpels.
Right. The intention was to vaporize abnormalities.
But the commercial landscape shifted pretty dramatically. Manufacturers and clinics started heavily marketing these powerful ablative tools for off-label cosmetic uses.
Off-label meaning not what they were originally cleared for.
Exactly. You see it advertised everywhere now as vaginal rejuvenation, marketed to treat laxity or to address genitourinary syndrome of menopause or GSM.
Which encompasses extremely frustrating symptoms, right? Like vaginal dryness, thinning tissue, pain during sex.
Debilitating symptoms for a lot of people.
Yeah, so I can see why the marketing is so appealing. The logic seems to be, if we apply a very specific lower dose of this energy, it will create just enough damage to stimulate a massive rush of collagen and blood flow to the area.
Right. It's essentially microneedling, but using thermal energy instead of physical needles.
What's fascinating here is that you're touching on the exact biological mechanism. The entire premise relies on initiating a controlled thermal injury.
A controlled injury.
Yeah. The device intentionally damages the vaginal epithelium, the surface lining, to provoke the body's natural inflammatory healing cascade.
But anytime you rely on the word controlled when discussing burning human tissue, you are walking a serious tightrope. And the FDA actually took a major issue with this.
Oh, they stepped in very aggressively. Dr. Scott Gottlieb issued a definitive FDA statement warning that using these energy-based devices for cosmetic vaginal rejuvenation is linked to severe adverse events.
Wait, like what kind of events?
The reports flooding in included severe vaginal burns, massive scarring, and ironically recurring chronic pain.
Oh, wow. The very thing many patients were trying to treat in the first place.
Right. If these devices are cleared for destroying precancerous tissue, isn't using them for rejuvenation a bit like using a blowtorch to warm up a chilly room?
What's fascinating here is that your analogy is spot on. It's an incredibly powerful tool, but the application is entirely different.
Because if that microinjury crosses the line from a controlled stimulation to an actual burn, the delicate mucosal tissue just scars over.
Yep.
It completely loses its elasticity.
And that FDA warning was issued for patients with healthy, normal anatomy.
Right.
Now, take that concept of a controlled thermal injury and apply it to a patient whose pelvic tissue is already structurally altered.
Oh boy.
Think about tissue that is sharing space with a foreign object. The concept of a predictable, controlled healing response completely evaporates.
Which brings us to the most severe contraindication in our stack of sources, and that's pelvic mesh. Let's look at what happens when you introduce this thermal energy to a vaginal wall that has been surgically reinforced by a permanent synthetic implant.
To grasp the danger here, we really have to look at the physical reality of transvaginal mesh. This is a net-like product, usually made of a synthetic plastic called polypropylene.
Okay, plastic net.
Yeah. For years, surgeons implanted this mesh to physically prop up weakened pelvic organs, a condition called pelvic organ prolapse, or to support the urethra to treat stress, urinary incontinence.
And the history of this mesh is incredibly dark.
Yeah.
Our sources point to the UK's Independent Medicines and Medical Devices Safety Review.
Right, the Cumberledge Report.
Yeah, widely known as the Cumberledge Report, or the first Do No Harm Report. It outlined the devastating complications women suffered from these mesh implants.
The complication rate was staggering. The body often recognized the polypropylene plastic as a foreign invader, which led to chronic inflammation.
So the body is just constantly fighting it.
Exactly. Patients suffered from debilitating pelvic and nerve pain, recurrent infections, and a horrific complication called mesh erosion or extrusion.
Mesh erosion. That's when the plastic netting essentially slices through the vaginal wall, right? Exposing the rough synthetic material inside the vaginal canal, or sometimes even eroding into the bladder.
Yes, it sounds like a nightmare because it is. Because of this, countries like Australia essentially banned its use for prolapse, and the UK placed it under extreme high vigilance restrictions.
So we have a plastic implant that already carries a high risk of cutting through tissue. This brings us directly to the medical policies from insurers like Capital Blue Cross and the safety labels for devices like the Mona Lisa Touch Laser.
What do they say?
They state very clearly, a history of reconstructive pelvic surgery with mesh kits is an absolute strict contraindication for vaginal laser therapy.
No exceptions.
But here's a question for you. If the mesh was surgically implanted, say, 10 years ago, and it is buried deep underneath the vaginal tissue, I'd assume a surface-level laser wouldn't even physically reach it, right? Why does it matter so much?
Well, because the laser's whole mechanism relies on the tissue's ability to heal itself from a burn. And if that tissue is already stretched over a rigid plastic net,
It sounds like the tissue would just give out.
you just described the exact pathophysiology of wound breakdown. A laser treatment demands robust, healthy epithelium to heal that microablative burn. But a patient with a pelvic mesh implant does not have normal tissue.
Because the body has spent years forming scar tissue around that plastic.
Exactly. The tissue overlying the mesh is often highly fibrotic, meaning it is thick with scar tissue, and critically, it has a compromised blood supply.
Oh, so it can't heal properly anyway.
Right. When you fire a laser into that fragile, altered tissue, you demand a healing response that the tissue is physically incapable of mounting. The thermal burn kills the surface cells, the tissue breaks down, and it retracts.
And when it retracts, the plastic mesh underneath is suddenly exposed. You have essentially used a commercial laser to artificially trigger the catastrophic mesh erosion that the Cumberledge Report warned the world about.
The irony is tragic, really. A patient might seek out an energy-based device to treat vaginal discomfort, totally unaware that firing a laser over their old mesh implant could trigger an exposure.
An exposure that requires, what, another surgery to fix?
Oh, highly complex, multidisciplinary surgery to fix. You can't just pull the mesh out like a splinter. The tissue grows directly through the pores of the plastic. Removing it is a major, risky operation.
Wow. Now, I do want to pull out a very specific nuance we found in the My Minoplan clinical source. Not all mesh is categorized exactly the same way when it comes to these laser contraindications.
That is a critical distinction for anyone listening who has had surgery. The guidelines differentiate based on the anatomical placement and the size of the mesh.
Okay, break that down for us.
So, large sheets of vaginal mesh used to repair pelvic organ prolapse are a hard, absolute contraindication for lasers. Hard no. However, urethral slings, which are very thin strips of mesh used to treat urinary incontinence, are sometimes categorized as probably fine, depending on the physician's assessment.
Wait, why the difference? Is it just because it's a smaller piece of plastic?
It's primarily about the anatomical plane. Prolapse mesh is placed very superficially, right directly under the vaginal skin where the laser energy is applied. But urethral slings are tucked away in a deeper, different anatomical layer behind the vaginal wall to support the urethra. The surface tissue over a sling is usually much thicker and healthier.
But this nuance proves why you cannot walk into a clinic and just say, I had a bladder lift a few years ago. The technician holding the laser needs your exact surgical operative report.
They absolutely do.
They need to know the specific anatomical plane that mesh is sitting in before they pull the trigger.
Completely. The margin for error is essentially zero.
So permanent synthetic plastic mesh is a massive red flag due to tissue fragility. Let's pivot to a completely different type of implant. What happens when we introduce energy devices to a removable metal implant, like a copper IUD?
Now, this shifts our focus entirely from the biology of tissue healing to the raw physics of electromagnetic fields and thermodynamics.
I love when we get into the physics.
It's fascinating. The copper IUD, most commonly the Paragard, is a unique device. It is a small, T-shaped piece of flexible plastic, but the stem and the arms are tightly coiled with bare copper wire.
And some models even use a silver core to keep the copper wire from breaking, right?
Right. To understand the interaction, we have to know how the IUD works in the first place. It is completely non-hormonal. The copper itself provides the birth control.
Just by being there.
Well, it continuously sheds copper ions into the uterus, creating what the medical literature calls a cytotoxic inflammatory response.
Which simply means it creates an environment that is highly toxic to biological cells, specifically sperm and eggs.
Yes. The copper causes a localized inflammation in the uterine lining, preventing fertilization. It is incredibly effective.
But at the end of the day, it is an exposed piece of highly conductive metal sitting inside the human body.
It is.
And this brings us to a major explicit warning pulled straight from the Paragard official FDA safety label. It states that medical equipment containing high levels of radiofrequency energy, such as diathermy, is strictly contraindicated.
We need to define diathermy because you don't hear that term often outside of physical therapy or surgical suites.
Right, what is that?
Diathermy is a medical treatment that uses high-frequency electrical currents to generate deep, penetrating heat inside the body's tissues. It's often used to treat deep muscle spasms or during surgery to coagulate blood vessels.
So it's blasting radiofrequency energy into the body. Wait, if a laser uses light, it generally stops at the surface because the light hits the water or pigment in our cells and absorbs immediately.
Exactly.
But radio frequency is an electrical current, so it just keeps traveling deep through the body's tissues until it finds resistance.
That is the exact mechanism. You are dealing with electromagnetic waves traveling through biological tissue. Human tissue has a natural resistance, which causes it to warm up gently when exposed to RF.
Okay, here's where it gets really interesting. What happens when those electromagnetic waves suddenly hit a tightly coiled copper wire? Is this basically the biological equivalent of accidentally leaving a piece of tinfoil in the microwave?
It is exactly like that. Copper is one of the most conductive metals on Earth. It's what we use in our actual home wiring.
So the copper IUD would absorb that radiofrequency energy instantly. It acts like an antenna inside the uterus.
It acts exactly like an antenna. The metal absorbs the electromagnetic energy and heats up far more rapidly and to a much higher temperature than the surrounding biological tissue.
Oh my God.
Yeah, the metal can reach temperatures that literally boil the surrounding cells.
So a patient getting a deep tissue radiofrequency treatment could unknowingly be causing severe internal thermal burns to their uterine lining because their IUD is superheating.
Yes. And this is not just a warning for obscure physical therapy machines. This applies directly to massively popular modern cosmetic treatments. Our sources highlight body contouring devices like Emsculpt EO.
Emsculpt EO is everywhere right now. It is marketed for burning fat and building muscle on the abdomen.
And it achieves that by simultaneously blasting the abdomen with two different energies. It uses radio frequency to heat and burn fat cells, and IFM high-intensity focused electromagnetic technology to force intense, unnatural muscle contractions.
So it's driving intense magnetic fields and electrical currents directly into the lower abdomen, right where the uterus and the copper IUD is sitting.
The clinical guidance here is rigid. Having an IUD requires a highly specific clinical assessment before treating the abdomen or the pelvic region.
I would hope so.
Yeah, the powerful electromagnetic fields from the HIFEM can interact unpredictably with the metal. There is a risk of the magnetic field actually pulling or shifting the device, and the RF energy poses a severe risk of superheating the copper.
So how do clinics handle this?
Most rigorous clinical protocols will avoid treating the abdomen entirely if an active copper IUD is in place. Or they will demand written clearance from the gynecologist who originally placed it.
Okay, but we need to draw a clear line here between the different types of energy. We just established that radio frequency is a huge burn risk because it penetrates deep into the pelvis. But what about the vaginal lasers we discussed earlier, like the fractional CO2 or the erbium-Y8?
This is where the specific physics of the device dictate the medical protocol. For a vaginal laser, having a copper IUD is not an automatic contraindication for the energy itself.
Because, as we established, laser light doesn't penetrate deeply. The clinician is firing the laser at the walls of the vaginal canal. The light energy is immediately absorbed by the surface water in the vaginal tissue.
Right.
It physically cannot travel up through the cervix and into the uterus to strike the copper IUD.
That's the core of it. The light beam cannot reach the metal to heat it up. However, just because the energy is safe doesn't mean you can just jump onto the treatment table.
There's always a catch.
Always. Having an IUD radically alters the pre-treatment protocol. According to clinical consensus from sources like the UK Women's Health Clinic, the provider is mandated to perform a physical speculum exam before they even turn the laser on.
So they need to physically check the wiring of the house before they plug the gadget in.
They do. They must visually verify that the IUD strings are visible at the cervix. They have to confirm the device hasn't migrated, or worse, partially expelled into the cervical canal or the top of the vagina.
Because if the IUD has slipped down into the vaginal canal, suddenly that shallow laser beam absolutely could hit it, heating the metal or reflecting those laser unpredictably.
Precisely the danger. But beyond just locating the metal, there is a complex biological interaction they have to assess. Remember how the copper IUD works?
By creating a localized inflammatory response.
Right. And how does the laser work? By triggering a thermal inflammatory response.
You don't want to stack massive inflammation on top of massive inflammation.
You really don't. The clinical guidelines state that the provider must rule out any unexplained pelvic pain, abnormal bleeding, or signs of pelvic inflammatory disease.
Makes total sense.
If a patient with a copper IUD comes into a clinic complaining of new onset pelvic pain, the UK sexual health guidelines dictate that they must be medically assessed. Complications like ectopic pregnancy must be excluded before doing anything else.
The terrifying irony here is that a patient might experience pelvic pain caused by a migrating IUD or an underlying infection and mistakenly think they just need a vaginal rejuvenation laser to fix the discomfort.
Yes.
If a med spa doesn't do a speculum exam, they could literally fire a laser into an active infection.
Which is exactly why these strict protocols exist. It comes back to respecting the environment the device is operating in. Whether it is a laser interacting with the fragile, scarred tissue over a plastic mesh implant, or an abdominal radio frequency machine turning a copper IUD into a superheated antenna, these interactions require deep, rigorous clinical respect.
So what does this all mean for you, listening right now? The ultimate takeaway from peeling back the layers of these FDA warnings, the Cumberland Report, and all these device safety labels is profound.
Your body isn't a blank slate.
It absolutely isn't. When you walk into a clinic, especially a commercial med spa setting that does not have access to your centralized medical records, you are the sole custodian of your health history. If you are considering the latest energy-based therapy, you must disclose every single thing. Even a seemingly routine copper IUD placed 5 years ago that you don't even think about anymore, or a tiny mesh sling surgery from a decade ago.
Every detail matters.
The conversation isn't just about whether a shiny new device works. It is about the physics of how it interacts with the materials already living inside you.
You have to protect your own internal infrastructure. The clinics are heavily incentivized to sell the treatment. It is really up to you to understand the contraindications.
Right. And looking at the bigger picture, This raises an incredibly provocative question for you to mull over. Medical technology is advancing at breakneck speed. We are constantly adopting new electromagnetic and thermal therapies into our daily wellness routines.
We use at-home radiofrequency wands, we wear high-tech magnetic wearables, we seek out ever more powerful clinical lasers.
It really makes you wonder, as the wellness industry accelerates, will the everyday implants and devices we confidently place inside our bodies today, the things we are told are completely benign right now, become the hidden, catastrophic contraindications of tomorrow?
It is a distinct possibility. The technology we use to alter our biology is evolving much faster than our long-term data on how these mixed modalities actually collide inside the human body.
So before you plug that shiny new gadget into your biological smart home, take a moment, check your wiring, make sure your infrastructure can actually handle the upgrade. Thanks for joining us on this deep dive.